I understand the importance of providing accurate and comprehensive information about medications to my patients. Keppra, also known as levetiracetam, is an anticonvulsant medication widely prescribed for various neurological conditions. In this video, we will delve into the common purposes, benefits, potential adverse reactions, recommended dosage, and risks associated with Keppra. Keppra belongs to a class of drugs called anti-epileptic drugs, AIDs, which are primarily used to treat seizures and epilepsy. However, its applications extend beyond these conditions, and it has proven to be an effective treatment option for various neurological disorders. By understanding the intricacies of this medication, patients can make informed decisions about their healthcare and engage in open dialogues with their healthcare providers. Common purposes of Keppra: epilepsy and seizure disorders. Keppra is widely prescribed to treat partial-onset seizures, generalized tonic-clonic seizures, and myoclonic seizures in adults and children. It can be used as a monotherapy, single drug treatment, or in combination with other anti-epileptic medications. Neuropathic pain. In some cases, Keppra may be prescribed to alleviate neuropathic pain, a type of chronic pain resulting from nerve damage or dysfunction. Its mechanism of action can help reduce the abnormal firing of neurons, leading to pain relief. Migraine prevention. Recent studies have explored the potential use of Keppra in preventing migraine headaches, particularly in patients who do not respond well to other preventative treatments. Psychiatric disorders. Keppra has shown promising results in the treatment of certain psychiatric conditions, such as bipolar disorder and anxiety disorders, when used as an adjunctive therapy alongside other medications. Benefits of using Keppra. Effective seizure control. Numerous clinical trials have demonstrated Keppra's efficacy in controlling various types of seizures, including partial-onset seizures, generalized tonic-clonic seizures, and myoclonic seizures. Favorable tolerability profile. Compared to some older anti-epileptic drugs, Keppra is generally well tolerated, with a lower risk of severe adverse effects, such as liver toxicity or severe rash. Minimal drug interactions. Keppra has a relatively low potential for drug interactions, making it a suitable option for patients taking multiple medications. Broad spectrum of use. In addition to its primary use in epilepsy, Keppra's versatility extends to other neurological and psychiatric conditions, offering a potential treatment option for a wide range of patients. Potential adverse reactions of Keppra. Like any medication, Keppra may cause side effects in some individuals. The most commonly reported adverse reactions include somnolence, drowsiness. Patients may experience fatigue, sleepiness, or difficulty staying awake while taking Keppra. Dizziness and coordination problems. Some patients may experience dizziness, vertigo, or impaired coordination, which can increase the risk of falls or accidents. Behavioral changes. In rare cases, Keppra has been associated with behavioral changes, such as irritability, aggression, or mood swings, particularly in children and adolescents. Headaches. Headaches are a potential side effect of Keppra, although their frequency and severity may vary among individuals. It's important to note that the severity and frequency of these adverse reactions can vary, and some individuals may experience no side effects at all. If you experience any concerning symptoms, it's crucial to consult with your healthcare provider promptly. Recommended dosage of Keppra. The recommended dosage of Keppra depends on several factors, including the patient's age, weight, and the condition being treated. Here are some general guidelines. Adults, 16 years and older. The typical starting dose for epilepsy is 500 mg once or twice daily, which can be gradually increased based on the patient's response and tolerability. Children, 4 to 16 years old. The recommended starting dose for children is based on their weight, typically ranging from 10 to 20 mg per kilogram per day, divided into 2 doses. Infants and children, 1 month to 4 years old. The dosage for infants and younger children is also weight-based, with a typical starting dose of 10 to 20 mg per kilogram per day, divided into 2 doses. Dose adjustments. Dose adjustments may be necessary for patients with impaired renal function or those taking certain medications that interact with Keppra. It's crucial to follow the dosage instructions provided by your healthcare provider and never adjust the dose without their guidance. Taking too much or too little of the medication can impact its effectiveness and increase the risk of adverse reactions. Risks and precautions associated with Keppra. While Keppra is generally well tolerated, there are certain risks and precautions to consider. Suicidal thoughts and behavior. Like other anti-epileptic drugs, Keppra may increase the risk of suicidal thoughts or behavior in some patients, especially those with a history of depression or bipolar disorder. Psychiatric adverse reactions. In rare cases, Keppra has been associated with psychiatric adverse reactions, such as psychosis, hallucinations, or aggressive behavior. Withdrawal seizures. Abruptly discontinuing Keppra without proper medical supervision can increase the risk of seizures or other withdrawal symptoms. Pregnancy and breastfeeding. Keppra should be used with caution during pregnancy and breastfeeding, as it may pose risks to the developing fetus or nursing infant. Driving and operating machinery. Keppra may cause drowsiness, dizziness, or impaired coordination, which can affect a patient's ability to drive or operate machinery safely. It's essential to discuss all potential risks and precautions with your healthcare provider before starting Keppra or any other medication. They can provide guidance on managing potential adverse effects and ensure that the benefits of treatment outweigh the risks. Alternative treatments to Keppra. While Keppra is an effective treatment option for many neurological conditions, it may not be suitable for everyone. In some cases, alternative treatments may be recommended, such as other anti-epileptic drugs, aids. There are various other aids available, such as valproic acid, lamotrigine, or topiramate, which may be more appropriate for certain patients based on their specific condition, tolerability, and potential drug interactions. Surgical interventions. For some patients with refractory epilepsy, seizures that do not respond to medication, surgical procedures like vagus nerve stimulation or resective surgery may be considered as a treatment option. Dietary modifications. In certain cases, dietary approaches like the ketogenic diet or modified Atkins diet may be recommended as an adjunctive treatment for epilepsy, particularly in children. Complementary and alternative therapies. While not typically recommended as standalone treatments, some patients may explore complementary or alternative therapies, such as acupuncture, herbal remedies, or mindfulness-based interventions, in conjunction with conventional treatments. The choice of treatment should be based on a thorough evaluation by a healthcare professional, considering the patient's individual circumstances, preferences, and potential risks and benefits of each option. How to take Keppra effectively. To ensure the safe and effective use of Keppra, it's essential to follow these guidelines. Take Keppra as prescribed. Follow your healthcare provider's instructions carefully, taking the medication at the recommended dosage and frequency. Consistency is key. Establish a routine for taking Keppra at the same times each day to maintain consistent levels of the medication in your body. Swallow the tablets whole. Keppra tablets should be swallowed whole with a full glass of water or other liquid. Do not crush, chew, or split the tablets unless instructed by your healthcare provider. Stay hydrated. Drinking plenty of fluids while taking Keppra can help prevent potential side effects like dizziness or drowsiness. Avoid abrupt discontinuation. Do not stop taking Keppra without consulting your healthcare provider first, as abrupt discontinuation can increase the risk of seizures or withdrawal symptoms. Monitor for adverse reactions. Be aware of potential side effects and report any concerning symptoms to your healthcare provider promptly. Attend follow-up appointments. Regular checkups and monitoring are essential to ensure the ongoing effectiveness and safety of your Keppra treatment. By following these guidelines and maintaining open communication with your healthcare provider, you can maximize the benefits of Keppra while minimizing the potential risks and side effects. Frequently asked questions about Keppra. Can Keppra be taken with other medications? Keppra has a relatively low potential for drug interactions, but it's still important to inform your healthcare provider about all medications, supplements, and vitamins you are taking to avoid potential interactions. How long does it take for Keppra to start working? The onset of action for Keppra can vary depending on the condition being treated and the individual's response. In general, it may take several days to weeks to achieve therapeutic levels and observe the full effects of the medication. Is Keppra safe for long-term use? Keppra is generally considered safe for long-term use when taken as prescribed and under the supervision of a healthcare provider. However, regular monitoring and follow-up appointments are recommended to ensure ongoing safety and effectiveness. Can Keppra cause weight gain or loss? Weight changes, both gain and loss, have been reported in some patients taking Keppra. However, the extent and frequency of these effects can vary among individuals. Is it safe to consume alcohol while taking Keppra? It's generally recommended to avoid or limit alcohol consumption while taking Keppra, as alcohol can increase the risk of side effects and potentially decrease the effectiveness of the medication. Can Keppra be taken during pregnancy or breastfeeding? Keppra should be used with caution during pregnancy and breastfeeding, as it may pose risks to the developing fetus or nursing infant. Discuss the potential risks and benefits with your healthcare provider before taking Keppra in these situations. Conclusion and final thoughts. Keppra is a valuable medication in the treatment of various neurological conditions, particularly epilepsy and seizure disorders. Its efficacy, tolerability profile, and minimal drug interactions make it a popular choice among healthcare providers and patients alike. However, it's crucial to understand the potential adverse reactions, risks, and precautions associated with Keppra to ensure its safe and effective use. By working closely with your healthcare provider, following dosage instructions, and monitoring for any concerning symptoms, you can maximize the benefits of this medication while minimizing potential risks. Remember, open communication with your healthcare team is essential. Do not hesitate to ask questions, express concerns, or discuss alternative treatment options if needed. Together, you can make informed decisions about your healthcare and achieve the best possible outcomes. In conclusion, Keppra is a powerful tool in the management of neurological conditions, but it should be approached with care and understanding. By staying informed and proactive, you can take an active role in your treatment journey and improve your overall quality of life.